welcome to the next episode of Cut to It, the nurse podcast, where we bring best evidence practice to you. A lot of OR material, but we're open to any kind of discussion. I am Dr. Rosemary Babo. I've worked in global clinical education and really focus on best evidence practice.
I'm Mary Ann Sanford, a registered nurse, operating room nurse, also worked in medical affairs. And it's great to have you on the podcast today. Thanks for joining.
Surgical attire and hyperbaric oxygen therapy. And what does that have to do with surgical site infections? Well, we'll bring you some very interesting information. Mary Ann, do you want to cover one of the papers that you've been looking into?
Yeah, and it's an important topic, this surgical site infections, right? The consequence of surgical site infections in the United States alone is 10 billion with a B dollars, which when I saw that, I couldn't believe it, but I can understand it because a surgical site infection, when it happens, is not always a simple superficial infection. It can go all the way down to the tissue you're working on. It can extend beyond the area you're working on. And when you think about the consequence and the treatment that's required for that, it's so extensive. It's actually not a surprise to me that it was a surprise, but that number being high was not a surprise to me at all. So it's an important topic, and we're looking forward to discussing with you today. There was a paper out of JAMA that from 2020 that talked about it was a surgical attire study, and they looked into the effect of surgical jackets and bouffant use and the association, if any, with surgical site infection risk. And we talk about the jackets and we talk about bouffants versus the skull caps, cloth or paper, the reusable versus the disposable. We talk about it all the time, and AORN talked about this as well. There's a lot of recommendations on surgical attire. I encourage you to go look those up. I also encourage you to look at clinical studies like we did. This one was interesting. It was a study including 34,000 surgical encounters, which is an enormous amount. So you know that this data would be very robust. And it included all surgical specialties. So there wasn't any bias between surgical specialties, and we know they vary quite differently. So there were several cohorts in this study, several groups in this study. One was people who wore surgical jackets and bouffant caps. One was surgical jackets alone. One was neither bouffants or jackets, meaning they wore a skull cap and no jacket. But interestingly, there should have been a fourth because there wasn't one on just wearing bouffants. So I don't know why they chose that as not to have that as a cohort or a group, but they did. So ultimately, what they found is that among those groups, those cohorts, there was no difference in surgical site infections among any of them.
Interesting.
And when you think about that, all the sacred cows of you have to keep your arms covered in the operating room, you have to keep your hair fully covered within a bouffant cap. Some people want you to have your ears covered. It's interesting to find out after 34,000 encounters that was the case. So that's a sacred cow. Probably need to stop worrying about the jackets. And actually, jacket use is very expensive, whether it's disposable or reusable. But the disposable ones, this particular hospital where this study occurred, they were able to reduce their hospital costs a little over $250,000 by stopping wearing jackets.
Wow.
So that sacred cow disappearing was really a boon to them and their budget, right? And also, bouffants are less expensive than the skull caps and the reusable, the disposable ones were, however. The study did not distinguish between cloth skull caps and the disposable like paper or woven ones. So we don't know if that had anything to do with it. I'm not sure why they wouldn't have included that as well, that information, but they did not distinguish. But clearly, there's no association in a really large study for surgical jacket use or for the difference between a bouffant and a skull cap.
That is really interesting, and I wonder. That's a large N number for that study, but I wonder if there are other ones out there that we could look at that included the bouffant. You would think that would be very much of interest to vendors,
And
to have
we've
that
always been
included.
taught we've always been taught to wear your hair within the cap. And I have a story, as I always do. I have a story. I worked with a hand surgeon who was excellent, by the way. I just have to say that. He shall remain nameless, but he was excellent. And he was fastidious about germ control in the operating room. He was just crazy with it. And one day I had my bouffant cap on, my ears were out, but the way my hair grows, it just so happens the little hairs in front of my ear don't get covered easily. They keep slipping out of the cap. And before the case started, he saw that and he came at me with the scissors. He was going to cut the hair off my head so that it wasn't showing. And he also had a theory that germs could walk. So if you had the drill hanging off the top of the table, he would wind around a steri drape from the table all the way down the hose and, of course, ruin it. But germs don't walk, right? Even after you connect the drill hose, germs aren't going to walk across up to the drill. So he was a little hyper excited about germs, but that was the thinking at the time about the hair being out of the cap. So clearly the study did not find that was an issue. Now, of course, we're not talking about somebody with long flowing locks and not putting them up, but we're talking about hairs that are in the exposed, exposed to the atmosphere, hanging below your surgical cap or your bouffant.
Yeah, and I think too, yes, they should all be tucked in, and I know there are not a lot. There are some women that, they're very concerned with the hairstyle and what it looks like, and even doubling up on bouffants so it, kind of keeps their hairstyle intact for when they go home and go out or whatever they do. But it is an interesting study and fairly recent. Thank you for sharing that infection that happens. It's a real hard one. It's very costly to the patient, and that's what brought me into actually finding this. It's from the Journal of Trauma and Injury from 2025. It was published in March of 2025, and it came up with therapies for dealing with surgical site infections, and the hyperbaric oxygen chamber was what they were recommending. And I was actually astounded by how many things, and I'm just going to read this off to you because I just found it very interesting. So an air or gas embolism, compartment syndrome, necrotic soft tissue infections, grafts and flaps that have not healed well, central retinal artery occlusion, thermal burns, radiation injuries, post-concussion syndrome, Lyme disease, and they're doing some research now too on fibromyalgia. And of course, we probably know them a lot more with healing for plastic surgery, a lot of times with facial plastic surgery, as well as for diabetes mellitus, which they have foot ulcers that aren't healing. They will put them into the chamber, and it's, I think, a wonderful, they show great results. On this study, it was where you would have healing maybe 25 to 30%. If you do the oxygen therapy, it takes it up to over 60 to 75%, which is astounding. Mm-hmm. And a lot of, there are a lot of outpatient facilities that are offering them, but there's a lot of hospitals that have, just for all these maladies that I mentioned, that they are now using them as treatment for SSIs and other things that are occurring. So wonderful alternatives, I think, instead of just one thinking I have to live with this and maybe even have my foot amputated because of an ulcer that's not healing. Try some oxygen therapy. Ask for that. Do you have any thing that you're seeing in your practice, Marianne, that has to do with this therapy being used?
No, it's very novel, and I like hearing about it. Thanks for bringing it to my attention. I think that, when you talk about just suction therapy, right? We would put the suction therapy on these wounds, and the poor patient, it's just a big rigmarole. It's just a lot, right? And then having to change the dressing and pulling it off, and it hurts and all. So when you think about the hyperbaric chamber, they're not like they used to. Like in my mind, I always think of an iron lung, right? Really old thing for people. And it's not that, but in my mind, that's what it looks like. But it's actually a chamber. You don't have to lie down. You could just sit there, right? And just sit there, and it doesn't feel that strange from what I understand, but you're not feeling like a patient. You're feeling like you're getting a therapy. And anything we can do for surgical site infections and either treatment or prevention is just critical. But I found that to be really fascinating. I can tell you that as a total knee replacement survivor, you are given instructions prior to the procedure. So the patient's involved in their own preventative care with surgical site infections, right? So we were talking about inside the operating room and after. We also have to talk about before, right? So now they have a HIPAA regimen. And in my particular case, it was 3 days prior and the day of,
Yeah.
right? So you have a full HIPAA procedure. And then the mupirocin ointment, which is put in your nose. Some clinicians like to do that to take care of the Staph aureus in there. And they also continue that afterwards, which I found interesting. So the patient is involved in their own surgical site infection prevention. And then, of course, like you said, asking for a therapy like the hyperbaric chamber that might really help them. It's very interesting that that's come around, but probably most patients are just not aware of it.
Yes, and I think it's, well, not only relaxing just to go in there. As you said, people really aren't aware of it. There are some people that can have some side effects to it, but it's really just like cabin pressure when you're going up and down in the airplane. That's really the mild sensation, but you can, be fully clothed in there, and it's just the oxygen that you need to really help at a cellular level. And almost like, why wouldn't you do it? Why wouldn't you do that if you have the opportunity? And I'm hoping that a lot more insurance companies cover this type of therapy, because it's something that, just look at the results of the increase in healing. Like, why wouldn't you do it? And almost like the wound vacs that you were speaking about, incredible speed to which they aid healing. So that's something that certainly will help the patients, but also bring down the cost of healthcare. And if you can prevent it, as you said, I mean, it isn't prevented, but it's helping. You can do it, actually, it's two ways. One, if you do it right after you've had surgery, which has been recommended, as well as help treat later. So you're cutting the cost two ways, shortening the treatment time if something has gone awry, or prevention. So I'm all for it. Sign me up.
It's
I'll
interesting
do a membership.
Interesting you're bringing up the insurance companies, and it's something we're not aware of. Like, what is the cost, and is it covered, right? I mean, so many novel therapies insurance companies are just not on board with. So as a patient, you might need to advocate for yourself to have such a treatment, right? But we have to do everything we can in the operating room and have the patient do everything they can prior to surgery to prevent surgical site infections. And it even comes down to instrument preparation and all that. There's so many things in the chain that could go wrong, but also so many things in the chain of doing a procedure that can go right. And that's really on us to do. We don't want a patient to get a surgical site infection, and we hope that they don't have to get a spa treatment. It's not really a spa treatment, but they don't have to go in the hyperbaric chamber. But I think that these two studies really illustrate all the work that's being done in surgical site infection prevention and treatment. And we hope that you enjoyed hearing about them.
Yes. So subscribe, send us an email, get in touch with us. Let us know what you'd like to hear about. And until next time, we'll see you.
Thanks so much for joining Cut to It. We appreciate you. Take care.